It's a new year, a perfect time to start fresh and take steps for a healthier you. But what should be on your health checklist for 2025? Well, today we're talking with Dr. Makira Simmons Robinson from Cone Health Burlington Family Practice. So let's get right into it. What is the number one thing that should be on everyone's health checklist this year?
So you want to have your annual physical scheduled. It's new year, fresh, clean slate. Go ahead and do like what you would do for your car, like a nice tune-up kind of check, but for your health. So have your annual physical, get that scheduled. If you have Medicare, getting your annual wellness visit scheduled. And if you do not have a primary care provider, find one ASAP. It's a perfect time to do it. We're all excited to have you and to get you started on a healthy journey for this year.
Okay, so make that schedule, and it could be this month, or it could be February, it could be March or April, whatever it is, but get it scheduled. All right, let's talk about some other health tests or screenings that are recommended based on our age or our risk factors that we should talk with our primary caregiver about.
Yeah. So if you have family history of breast cancer, making sure you're getting scheduled for that mammogram, asking your provider, hey, can you order my mammogram for me? If you have history of prostate cancer, asking for those PSA levels to be drawn with your blood work. It's also good to know, what are my kidney enzymes looking like? What do my liver enzymes look like? What is my potassium, sodium? Getting those metabolic panels, they can be good to have that good baseline to know where you stand. It's also good to know, hey, are my blood counts okay? Am I suffering from anemia? So getting that complete blood cell count is also pretty beneficial in things that I typically order for my annual physicals.
Right, and a lot of those are covered, so you can have the discussion with your doctor about that and ask them questions. So vaccines, also a big part of prevention. How do we make sure that we're up to date? Sometimes, they ask me, when's the last time you got this or got that? And I'm like, I don't remember.
Yeah, exactly. And I think the biggest thing with vaccines is knowing your status. So what vaccines have you had? I know when I was younger, we had the little pink, and well, girls had pink and guys had blue, little folder of your vaccine records. And my mom kept that for a long time. But if you don't have that, just asking your provider, hey, is it possible for me to get a copy of my vaccine record? So we're able to see what you've been administered in North Carolina. But if you're coming from a different state, probably getting those records before you transfer to a new provider here in North Carolina would be super helpful. We don't want to double up if we can avoid it. But asking about COVID vaccine, asking about RSV vaccine, asking about the pneumonia vaccine, it is still plenty of time to get your flu vaccine. So please, if you can't get it with your primary care provider, get it at your pharmacy. Especially in this season, we want you protected as much as possible.
Okay, and I'm thinking to myself, the people over 50, the shingles vaccine, right? Because I see that on the commercials all the time. All right.
Absolutely.
So what should be on our health checklist related to exercise and nutrition?
Okay, so a lot of things.
So many things. Where do we start?
But if we want the nice, simple, what is the number, Dr. Robinson, I usually recommend 150 minutes per week. So about 30 minutes, 5 days a week, if you can do that. But I think it's important to remember, if you do a 15-20 minute walk most days a week, I am like, yes, please. And we check that box off. That is getting your body moving. I think it's also important to do movement that you enjoy, that you look forward to doing, so that it's not a chore, but it's also getting that heart rate up. And, as you get older, if you don't use it, you lose it. So I often tell my patients, like, hey, I need you to stay strong. I need those bones to stay strong. Get moving. If that is doing water aerobics, if that is, climbing your stairs during commercial breaks while you're watching your favorite program on TV. Anything to get you moving and just not so you're just sitting and being deconditioned. And then as far as nutrition, I think it's easier to add than it is to take away things. So drink more water, eat more vegetables. If you can get half of that plate vegetables, I'm a happy camper.
I love the adding versus the taking away. More water, more veggies.
Yep.
Okay. All right. We're also going to be talking about mental health, well-being, and we need some steps that should be on the checklist too when it comes to taking care of our mental health. Yes?
Yes, yes, yes. So a couple of things goes there. So I think just prioritizing that time, just some quiet time. If you can do 30 minutes a day, just quiet. Giving yourself the opportunity to reflect. Like, did I have a good day? Was today a little more challenging than the day before? Um, Kind of quieting out the voices. We get a lot of chatter, a lot of critique, and going over the things that we did today. So giving yourself that time of reflection, and then doing things that you enjoy, having something planned that you look forward to. So that could kind of check off two things if you're doing something you enjoy that's movement focused. But if it's reading your favorite book, reading a chapter every day, that feeds into that wellness. It makes you happy, it makes you feel better. Um, and then if you notice that things are just getting too much for you, you're feeling more nervous, you're more on edge, you're worried about everything and can't quiet that mind down at night to sleep, then it might not be a bad idea to speak with your provider about it. There are medications, and I am a huge, huge, huge fan of talk therapy. So there is nothing wrong with getting a counselor, therapist, and just having that time to talk.
All right, all the way around. You want us to be healthy all the way around. I love the fact of
Absolutely.
the 30 minutes of just being quiet and checking in with yourself. Did you
Yes.
have a good day, right? All right, so what we're going to do, we're going to take a quick break, but we're coming back talking about the checklist for 2025. We'll be back in just a few minutes.